get flagged on. So we got a little music going. We are live here with Dr. Laura McKaig, physical therapist from Overland Park in the great state of Kansas, but not the same state where the Kansas City Chiefs play, for those paying attention. I'm going to lower this. So, Laura, Dr. Laura, yes. We are here to talk about a very, we'll call it a taboo, tough topic that we connected through this mastermind group, Uncaged Clinician, and we'll leave all that on the side. But the thing that you specialize in is not just, well, it's women's health as well, but today we're going to focus on that kind of bigger taboo of men's health. Right. So what does that mean? I used, I don't know if you saw the headline here, but it's men's health is more than just a magazine, right? So, yes. So I'm gonna spit out my gum. I just had some amazing barbecue that I'd be curious how someone from Kansas would feel about this barbecue here in Colorado. But
I think someone needs to come to Kansas City and experience really, really good barbecue.
We drove, when we did our cross-country trip, we went down to New Orleans and through Texas. We avoided the middle there, so we definitely need to hit that. But yeah, let's jump right into it. You do have a patient at the kind of top of the hour or after, a little bit after, so I want to be respectful of that. But yeah, this is a taboo topic, if you will, because again, men, if you go to your doctor, especially when we get to a certain age, or again, we were talking about, I mean, this can happen in your 20s, stuff that's going on that is just not easily talked about. If you go on WebMD or Google, like you get some weird information, I think. And this is where Dr. McKaig can come in and work with men. And she does work remotely, virtually, telehealth. So I want to definitely hear about, what are these types of symptoms to look out for as a man, right? B, if you already have diagnoses, and we're talking about like erectile dysfunction, we're talking about any kind of incontinence that tend to develop toward, later in life sometimes, but also, again, as we said, can happen earlier in life in your 20s, 30s, and can be signs of more serious things. And if you don't have somebody like her to talk to, and have kind of conversations to check you out, to see what's going on and see if there's something we can do to make it better, it can be an issue. So I'm going to let you talk, because this is your specialty.
All righty. Well, I do like to talk and I love to educate. So if I ramble a bit, just kind of herd me back to the topic. But yeah, it's an excellent topic. It's kind of funny how I got into men's health, because a lot of people think, well, if you're a pelvic PT, don't they just treat women after they have babies? And the answer is no. And one of the big questions is, oh, men have a pelvic floor too? Yes, they do. And, men have a pelvic floor, women have a pelvic floor. It's just a group of muscles that are in that pelvic area. Kind of if you're sitting down and you're on your sit bones, those muscles go between your right and your left sit bone, and then they go between your pubic bone and your tailbone. So they kind of form like a hammock of muscle that supports your abdominal, your pelvic organs, and they're really, really important in bladder and bowel function, as well as sexual function, which is super, super important for nearly every guy. And yeah, there's a lot of things, just like with women, if your pelvic floor isn't working right, there's a lot of things that could crop up and present as problems. And sometimes guys don't even know, wow, is this supposed to happen as I get older? Is this normal? So we start there. Okay, one, we know there's a pelvic floor. It's a group of muscles, and they could be not working in the right order. And I'm sure Dr. Bose talked about that. The muscles got to work together as a team for your system to function. So that's one problem we see. Yeah, like if he had to lift, a couch, and you're trying to flex your biceps, but it's like 2 seconds delayed, or it's not working with your triceps properly, how effective are you going to be actually lifting anything? So we work on that. There's also problems with the muscles being too weak And sometimes we see that in incontinence, where all of a sudden you're leaking, and that could be leaking pee, that could be leaking feces, or both. And so we work on strengthening the pelvic floor, but it's not just about strength. Your muscles could actually be too tight and too ramped up, and that's when we see a lot of problems in younger men. Like if you're lifting and all of a sudden your testicles hurt. And yeah, I'll just say it right out. You know, that might actually be tightness in the pelvic floor, but I look a little bit up and it could be tightness in the abdominal muscles. So one thing we don't know, a lot of the tissues from the abdominal muscles share the same origin as that in the scrotum and the testicles.
So I'll jump in and say, the way when the term core is very often discussed, you know, and again, most people think of it as six-pack abs. And again, anyone who's gone through any kind of basic physical therapy of any kind of quality physical therapy knows that the core is more than just your abs. It's, you know, the canister from, and again, we can, you know, some people define it in different ways, but, you know, we talk about the trunk, everything connected. So the way I usually talk about it is it's a canister that the top, if you think of like a can of Coke or a bottle of water here, right? The top is my diaphragm, kind of right at the bottom of the rib cage. That's where my breathing is controlled. That's why breathing is so incorporated with some of this stuff. That's why it's the first thing I look at any human I work with. The bottom of that canister is this pelvic floor. So the ability to, you know, stop the flow of urine. Some people cannot do that. And the ability to strengthen those muscles that we tend to either never think about or, you know, just it can get damaged. That's, again, like you're saying, some of these connections, we maybe do too many core exercises and we're not engaging some of these other muscles. So, and then the other part of it would be, you know, if we really wanted to use the analogy, the six-pack, right? We have the whole wraparound transverse abdominis that creates that belt when you do brace, connecting into the spine. And that's another part for me. People have back pain or hip pain, and they're not, either nobody's checking them out for men's health type situations. And it's sometimes tough to go into that. Again, from PT school, what do they teach us? They teach us to, you know, look out for cauda equina. That's like, because that's for anyone who doesn't know that term, it's a pretty, you know, it's an emergency situation if you're either numb in your private areas, or if you're having any kind of emergency situation there. That's what we are taught to look out for, but we don't get into the nuance, the subtlety, and that's where we bring it back to Dr. Laura McKaig. And the question I'll throw back to you is, explain to the listeners here how do we do this in a virtual setting, I guess, is the question on my mind.
Well, I do see people virtually, and especially in the states of Kansas and Missouri. I'm licensed in both states. And if I'm not able to see people virtually for actual treatment, I do see people for just resources. I mean, you'll get out there and there are some issues such as premature ejaculation, pain with erection. Those could be very much related to pelvic floor issues and actually quite treatable. Or you're peeing every, 10 times a day, and you're getting up 5 times a night to pee, and you're in your early 30s. That's not normal.
Right.
You know, so we look at that. We're like, hey, what's going on? How long has it been going on? And we try to pick out those factors that might have, let's say, set the stage. And when I do, okay, you know, I usually like to do a hands-on exam to see, you know, what is the state of that pelvic floor? What are your abs like? What's your low back like? But in the absence of that, then I become your guide. And then I can guide you through, hey, you know, if you sit down and you're breathing, what's your pelvic floor doing? Do you even know? You talk about breathing mechanics. Those are super easy to work with virtually. And then just find out, is the problem more of maybe a tight pelvic floor? Is it more weakness? Is it more coordination? And then we come up with a game plan. Okay, here's the problem. Here's what we found out this is what we need to do to fix it. This is how long it might take. And then we get started, you know, that's that next step. Oh my gosh. Thank you. I feel validated. I knew I had something going on. Nobody could figure it out, or nobody believed me. Thank you for showing me that, yeah, there is something here, and even better, there's something I can do about it. And I think that's a big thing a lot of guys don't get is, oh yeah, there is hope for dealing with these problems.
Yeah. And I put your website link right there. I don't know if you can see that, Laura, but
there you go. Yep.
Yeah. So well, we got to get your head a little bit higher, I guess, but you got to sit up tall.
I do. I am actually.
Well, I always do these standing, and you know, for everyone getting Zoom exhaustion, it helps to keep you active. And I probably move around more than I should, but I want to, again, keep that website on there and tell folks that call to action that, again, you know, confidentiality is always a thing, right? So don't be embarrassed, but click on the link and you can set up a 15-minute free consult with Dr. Laura. I offer the same thing for more movement literacy, not specifically men's health. That is not my specialty. That's why we have people teaching me things that I don't specialize in. So hence Bo knows stuff. Our 1% better concept, again, for anyone. And I also said in my little promo, if you are a man, or if you have a man in your life that you care about, especially, you know, I think, and again, I know that messaging can be a little different, but I think, again, the older we get, the more we need these check-ins. You know, again, if you go to your primary care physician, annual checkup kind of thing, I believe at the age of 40, they start doing prostate checks and things like that, right? And that could be connected to, you mentioned frequent urination, especially overnight. And those are things to keep an eye on. And again, we're talking big picture, big health picture, but it's hard until, you know, and you get to a point where you can't perform sexually, and you either have premature ejaculation or erectile dysfunction, all those fun terms that we get ads for every day on whatever you might be watching that has ads. And it's easy to say, cool, I'm going to take this little blue pill or whatever new technology they have, and not even realize that we talked about breathing. And my fun thing with this is the nitrous oxide that's basically in Viagra and now all the new ones. I can't keep up with what the new ones are. But it's nitrous oxide is being released, and they actually produced it as a heart treatment. And it turned out, it just improves your blood flow. So therefore, you know, something to keep an eye on. And you can do that by simply doing nasal breathing. So shut your mouth and only breathing in and out through your nose for a little while. And I try to have a lot of my clients do that. And again, it actually helps control and improve breathing mechanics and probably starts to relax some of the wrong muscles. And I think I was going into it before, and I'll wrap up my little stream of consciousness here and then come back to you. But again, we don't realize that, again, that back pain, the hip pain is so closely connected. We talked about the core and how that's all set up, but back pain is 80% of people, and the general diagnosis that you're going to go through MRIs, you're going to go through x-rays, it's non-specific low back pain. We are here to help you guys, again, be those guides like you're talking about. Check in with people offering free consults. Like we're out here figuring out, the reason we're in a mastermind is because we're saying, how do we get to more people? We want to help more people. That we know that there's people out there who need our help for movement literacy, lifestyle decisions, men's health type situations that they just don't know that these resources exist. So we're in this crowded marketplace where, again, people are going to go much quicker to that little blue pill rather than do a virtual check-in with, you know, someone offering a free 15-minute consult. So yeah, it's a crazy time we're living in, but we just want to reach more people. So if you're out there, and again, I can't stress enough that if you're a man, check in with someone like Dr. Laura McKaig. I know there's other men's health PTs out there who are talking about these concepts. And again, I was so excited to get you on here and talk about this. So,
well, thanks for having me, because part of the problem is, one, there's not enough of us who will treat men, and two, it's really hard to find us. And so I've got access to different directories. If you're in like Nevada or I don't know, Florida or something like that, it's like, hey, let's find someone in your area who does this, who can reach out to you. And also just the importance of, I wish it wasn't this way, but you have to be your own advocate.
Mm-hmm.
And so many men who have come here and have been treated, they're just like, I have been looking and there's nothing online. My doctor doesn't know what to say. They'll even go on some of the men's health websites and there's nothing mentioned about PT.
Right. Yeah,
And,
that always, that for so many different conditions too, not, this specifically, but that always burns my britches, So
So
yeah.
if you have an inkling something's not right, whether it's in your privates or your low back or hip, and you just don't feel like you're getting the answers you need, keep on pushing and keep on advocating.
Mm-hmm.
Yeah.
Yeah, absolutely. Again, that goes back to, I think, where we connect. And then again, I will shout out my lovely wife in the other room. You guys have connected already a few times, and maybe there's a good conversation we can all have that again circles around this. So she's dealing with folks with a lot of the same conditions, and we get down to, and I know I've spoken with her on some of these. And I'm sure you referred to folks like her back and forth of, is this coming from a psychological thing? You have trauma going on? Is there something in the relationship? Are there performance anxiety issues, what have you? Versus it seems to be a very physical thing, and we want to make sure we clear that. And the same thing with the, again, back pain and things I'm dealing with with my clients and everything around the world, of this kind of biopsychosocial model of, again, the mind-body connection. Where is it breaking down? Can we continue to build confidence through small exercises? You're breathing better. These little things that add up. I go to my 1% better daily thing. And again, that's what it is. It's again, I think a call with someone like you with an issue that's so taboo becomes, 50% better just from having that call. I'm aiming for 1%, but we have these, it's always these larger levers that we can pull to make a bigger difference. And again, it's unfortunately, these are just things that, we let go by. I keep, sorry to ramble again here, but I keep going on the, we get our cars checked every 6,000 miles and oil changed. You're supposed to go to your dentist, whatever it is, twice a year to get your teeth cleaned and things like that. You're supposed to get your annual checkup, your blood pressure and things like that. But yeah, these aspects of our body, maybe because it's uncomfortable, maybe because it's taboo, we tend to ignore it until it becomes a pretty serious issue, and then it's so much more difficult to treat down the line. So, but again, if you are seeking treatment for that, again, there is this resource that people just don't even realize is there, because again, it's, take all these pills, they have all the millions of dollars and billions of dollars, might even be in the T's, the trillions. I'm not, it's scary stuff out there, but again, it's and I'll stop. This will be my last ramble point is, again, in the way COVID has gone, is very few folks, everyone's talking about vaccines and stuff, but very few folks have talked about lifestyle change, have talked about eating better, exercising more. Like, these are the things that if you can build your immune system that way, it's an investment. It's a long-term thing. So it's a lot less sexy, but again, these are the things that we need to do. You got to do the work. You got to find the people who can help you the right way. So we're talking about, the value you can get from a 15-minute call. I can't stress enough for anyone out there listening. Again, you might have a parent, cousin, whatever it is, and it's, again, it's not just men. We're focusing on the men part of it, but I think the women's health stuff is definitely getting a lot more press these days, which is great.
I'm gonna stand up too. There we go.
There you go.
I'm taller than you now.
Now you're taller. I do have a trampoline back here. I'm gonna let you talk while I jump.
There you go. All right. Well, and like what Dr. Bo said, are you hearing an echo? I'm hearing an echo.
It was probably, I put my headphones down.
Got it. Okay.
Sorry.
Sometimes I always have people come, what's my next step? And sometimes that next step can be super simple. Sometimes it's real complicated, but like, do you hold your breath? It's like, man, I leak every time I stand up. Or when I get anxious, all of a sudden I have that urgency and I got to go pee real bad. Are you a breath holder? Maybe. Well, how about you exhale during the exertion, whether it's a workout or standing up from a chair, try exhaling. And in some cases, that alone can make a difference.
Yeah, I say my cue that
Yeah.
I give is inhale on
Mhm.
initiation and exhale on exertion.
Yeah.
Exactly. So
Mhm.
you brace, inhale on the as you're about to start, make sure you're set,
Mhm.
brace,
Yeah.
and then exhale as you're doing whatever
Right.
that
Mhm.
piece is. And yeah, I'll double down on
Yeah.
what we were saying before of, again, yeah, those are issues. Again, I see, and I don't want, for me personally, I don't want to have to wear an adult diaper. And these
Right.
are things that are very avoidable.
Mhm.
And again, if you're in that situation where you have to, there's nothing wrong with it. Again, we can fix it.
Yeah.
We can
Mhm.
start to get you on that path to healing, but it's about figuring out how to do that. And again, especially with men, and I talked about it I had a live yesterday with a CrossFit
Mhm.
Games athlete, and we talked. We didn't talk necessarily about men's health, but we talked about
Mhm.
the mask of masculinity, which
Mhm.
has been at least two different places, two different books, I think, of the same name. A friend of mine, Wade Davis, who was a professional football player, and then Lewis Howes, who I think he was actually an Arena League football player too. So ironically,
Okay. Yeah.
but they both they have very different kind of paths that they talk about. Of again, yeah, as men, it's just we have these egos. We're taught these things. We're taught to. And again, my friend yesterday, Jeff Evans, is a black man who in the black community, it's just much more frowned upon to express your emotions, and especially there's distrust of the healthcare system, rightfully so. From a lot of historical stuff, and so it's about, again, overcoming some of this stuff, starting to hopefully heal some of those wounds, those negative practices, if you will, of again keeping that stuff bottled up until it explodes. So again, we're here to say, there's no reason to not do a 15-minute call. Go on her website right now. I'm going to put that link up again. I feel like it's a telemarketing thing, and
Should I stand up again?
I don't know if you want your mouth covered. I don't know how to move that thing, but yeah. But again, we can't stress it enough, guys, that go to our website, set up that 15-minute call. If you wanted to talk about, again, your where you are for your health. So, and again, that's where I'm coming at as from my side of, let's address, again, your lifestyle stuff. Again, are you sleeping well? All these things add up. Again, that's my 1%.
Yes.
So I'm 37. I'm looking to, by the time I'm 67, be even healthier than I am today. I know there's the fight against aging, but you have to start taking those steps, just like we do, again, with our cars, with our finances. We start putting money away, saving money, investing money, make that money work for you. But, and I know so many folks who do that and ignore their health. So when you're 65 and you have a couple $1 million sitting there, but you can't enjoy it because your body's, pretty minimal in terms of its functionality. So yeah, I keep striving for that longevity, and I can't, I don't know. That's my my personal ramble about the men's health thing. But we talked about, let's re-emphasize, I think, what to look out for. So you mentioned like pain in your testicles with exertion. That's one thing.
Yeah, or any pain down there. Whether it's a deep pain, a superficial pain, pain during sex, pain right after sex, something like that. That's not normal.
Right.
And it doesn't mean you have an infection. Usually it's like, I don't know, you have an infection, here's some antibiotics, or worse, nothing.
Right.
So it's like, well, why do I even bother talking to my doctor about it? What will they do? But yeah, pain in that area. If you are getting up and going to the bathroom more than 3 times a night, if you are having to pee, you get that strong sudden urge and you can't really hold it. It's like crazy strong, and you're dribbling on the way to the bathroom.
Yeah.
Things like that. Yeah. Any type of sexual dysfunction.
Right. And I will.
Or any abdominal surgery. I have had a couple guys in here who have had crazy, huge abdominal surgical scars and were just sent home and given no rehab whatsoever.
Right.
So physical therapy, as you know, can do wonders in just helping keep that scar tissue from locking down to everything. And and even affecting the pelvic floor. So
Yeah.
if you've had major abdominal or pelvic surgery, it would be really, really a good idea to get some rehab for that.
Yeah, I've had definitely a few clients who came in again for back pain, and this happens more frequently with women with C-sections, and those scars get bound down, and they're never taught how to address those scars. I found that to be much more common. But again, a lot of folks guys come in with back pain, and again, we do the assessment, and a lot of clinicians, doctors won't even look at the front. So yeah, I had a guy pretty recently, actually, he's in the movies and things. I can't say his name, HIPAA and all that, but he did have I noticed a scar, and it was an appendectomy. He had his appendix out, I believe, all the way back when he was like 12, and he's in his 40s, 50s now, and it was never looked at, and it was pretty tender still. So that's a sign that there's stuff going on there, guys. And again, this is, anyone who's not familiar with how scars can go, it becomes this little vicious cycle, and the brain continues to sense these scary things. Unfortunately, there's all these different theories on pain, but again, cleaning that up and starting to desensitize it, literally to the point where me touching it with my fingers to try to work in there might have been too much for him. And again, it's something he might not be comfortable with. So either we need to, open up those dynamics, trust on it. Cause I said that on the first session, and he was like, "What are you talking about? Like, it's my back." I'm like, "I think I know what I'm talking about. I've seen this a lot of times." So it might be desensitizing with something. This is like a tissue I just grabbed from the table here. And it might just be that softness that we need to start to desensitize and get the body and the brain acclimated to some version of getting it softer and building up, that tension that we can put in there. And again, that's going to unwind, so to speak. So for anyone else not familiar, I will say again, fascia and scars and things like that, similar on my shirts. Anyone watching the video, if you're listening, you'll have to go on the YouTubes, but that dog almost just got run over out there. That's good. But if you see these kind of these lines on my shirt here, if that represents what's going on in our body underneath our skin, right? If I have something going on down here, and that's the scar, and that pulls all the way. Now it did straighten these lines out, but there's a lot of tension here. So I'm pulling all the way down here. It's creating these lines of pull. And so if we can loosen that up and get rid of these little wrinkles, we're going to allow the skin to move a lot better, right? I think we can all kind of see that visually, or even if you're listening, I think you should be able to visualize that concept of, again, if you get that wrinkle out of a shirt, or you had a snag on your shirt, and you can clean that up, it's going to, again, give your shirt more freedom. Again, people who come to me and they have stuff going on with their shoulder and they can't raise their arm overhead. Again, we got to go down all the way down to the other hip. We got to make sure there's nothing clogging that motion. It might be stuff in the shoulder, and that's where, we're going to tend to focus, and where you as the patient want to go. But sometimes, we have to look at that entire picture. So can't stress that enough.
Absolutely. Yep. Yeah. A lot of times, and with any physical problem, those pelvic floor problems are rarely just confined to the pelvic floor.
Do you have a little beeping? Okay, I heard a little beeping. That's fine now. It went away. I don't know if that was me. But sorry. Sorry, you were saying.
Yeah. No, the problems are rarely just located to the pelvic floor. In that fascia example, I do a lot of myofascial work, and that's when I'm poking at something right under the rib cage, and all of a sudden somebody says, "I feel that radiating pain all the way to the tip of my penis. What the heck is going on?"
Right.
And that's when we kick in more breathing exercises, and the origin of the whole thing might be up here.
Right.
Yeah.
It's all connected, folks. It's all connected.
Yes,
the fancy term for that in our research and physical therapy literature is regional interdependence. So basically saying, it's all, if you have stuff going on your shoulder, your hip is connected. The old kids song, your hip bone's connected to your thigh bone and all.
That's the song you should have played.
Yeah, maybe.
That'd be good.
I don't know. Sexual healing seemed appropriate at the time. I don't know. It seemed worth the possible copyright ding on YouTube and stuff. So,
well, speaking of, I'll give you one tip, and this goes with what you teach all the time, guys. Probably the easiest way where you can still be enjoying sex way into your 60s and 70s and beyond take care of your heart.
Mm-hmm.
Heart health, cardiovascular health, and sexual health are very much linked.
Mm-hmm.
And if guys start having erectile dysfunction problems, that's often a risk factor and an indicator that there's something going on with the heart and the cardiovascular system. So, ditch the smoking, eating better, stress management, all that. Yes, that does play into sexual function as well.
Yeah, who doesn't want to keep having sex into their 90s?
Yes.
I don't know who doesn't, but and again, not having to rely on a pill. It's great that we can rely on, we have that technology if you need it. But again, I don't want to rely on the side effects around those pills and having to pay for those pills and all that. Why not find a way to keep it, healthy? And I guess the argument is, like, how much work do I have to do for that? And we have those the lizard brains. But yeah, that's my redefinition of fitness. Again, if you chase fitness, meaning you can go and do a Cooper test, which is how far can you run in 12 minutes? If you can stay healthy with that, and that's going to coincide and correlate to a lot of these other factors, like you're saying, smoking and all these other things. But if we can look at your overall fitness, which again, most doctors don't look at your actual fitness because they don't have the capacity for it, whether we're actually doing a VO2 max test that you put a mask on and you do this very intense kind of treadmill test, which not everyone needs to do, but it gives us really good information if you do it. And again, that's where I have these conversations with a lot of my clients. There's other ways we can look at your overall health and fitness. So yeah, it's this continuum of general fitness. And the more you take care of your fitness as we define it, of, not just what's your blood pressure, what's your cholesterol, and how many push-ups can you do, things like that. But if we can put this picture together and say, again, I'm 37, by the time I'm 97, I want to have everything continue as much as possible, move in the right direction, or at least, again, move as little as possible in the wrong direction, and there is a natural aging process and we can only fight that so much. But again, if you're accumulating plaque in your teeth every day and you're just not brushing, that's what's going on with a lot of folks' heart conditions. And like we're talking about, then eventually it clogs, just like, you get hair in your drain, it's going to eventually back up. And then you need to either put the snake in there or the Drano or whatever. And that's what's happening to our cardiovascular system. We're clogging it up with plaques and things like that. And yeah, again, I think we're going to keep running ourselves ragged talking the same thing. But yeah, if you guys haven't gotten those concepts or you're not ready to commit to, those lifestyle changes, we can't twist your arm in it. Again, I talk about my population that I want to work with, and it comes down to motivated people who understand that, and they're just looking for answers. So I think folks who are ready to hear the answers, that's who I want to work with. That's who I end up usually working with people. And I think it's going to be the same for you, Dr. Laura, of people who have failed or gone to 5 other practitioners and been told, or that, they've done their own research and they've tried XYZ, and it's been a frustrating process because nobody bothered to, for you, it's going, just being like, hey, this is the language. If we're not talking about this concept, like, what do you feel on your penis? Like, it's not a bad word. Again, hopefully we don't get.
Well, and I've had more than one guys come in who have had pelvic PT before. And, I have a very different approach. Not everybody's comfortable, going there. Not everybody's comfortable working the anterior part. And sometimes that's what needs, that's what needs the attention. That's what needs the therapy. And they're like, no one will touch me where I hurt. They're doing this or doing biofeedback, but it's just, not really helping.
We're not getting to the heart of the thing because there's this, again, societal or
like, you have to learn to be comfortable with it, kind of get comfortable with being uncomfortable. But, okay, there's muscles there. There's muscles there at the base of the penis and the scrotum. And if we're not addressing that, you might not be helping the problem. And you start that and they're like, see, I told you it was there. And they get better in a couple of visits.
Yeah. That's the crazy thing. I think for both of us is when we hit that proper pathway that again has just been ignored for various reasons. For me, it's usually a lot of people chasing the wrong symptoms, and they're just, if they have knee pain, they're like, I did this to my knee, I tried this program. And it's like, okay, well, you never really attempted to improve your movement pattern and address the cause, which I think is the same thing for you. So when you do get that right, and we're like, this is what's actually going on, and we're pretty darn confident about that, you and I, and then you, like you said, it changes things like that, and you're gone. You eliminate this thing that's either been plaguing them for a long time, causing all sorts of very significant stress and psychological problems for folks that, again, doesn't need to be there. That's been my main mission, passion of saying, we don't need, for me, it's that long-term chronic disease stuff. And again, it connects to sexual health for sure. Again, if you chase your fitness, we can be avoiding Alzheimer's down the line, these degenerative changes that, again, have become so prevalent in our society, and just becomes like, so many people I know have that, but it's like, you don't need to. I'm even talking to a lot of folks. We have my high school football guy group, and folks are complaining about their this, that, or the other thing. Again, a lot of folks are going bald. A lot of folks are graying their hair. Some of that's genetic, but at the same time, I'm like, I think it's stress that's been going on, and it's stuff that you've been mismanaging and like showing up that way, believe it or not. Again, we're not gonna, I doubt that's gonna come up in one of our talks of, well, my penis hurts when but it's something that, again, doesn't get talked about, and therefore doesn't get treated, and becomes more of a problem. So this is where we got to keep breaking down these walls, fellas, ladies, everybody. So I think you have a patient coming up, unless there's some other big concepts we want to cover. Again, I think this is stuff we need to keep shouting from the rooftops, and I'm happy to give you as much of a microphone that I have to share that. But anything else before we wrap it up?
I will share a story. I wanted to get to my male pelvic health model, but it's a little far away, kind of showing the relationship. But I was talking with someone who is, I work with guys after prostate cancer treatment. And a lot of those guys, have problems with the incontinence, sexual dysfunction, all that. And that's rarely, if ever, addressed. And so I was giving a talk, and he was there about, men's health. And he was just like, hey, now wait a minute. If we are going to have knee surgery, don't we have rehab for our knee after the surgery, and maybe even before? Well, yeah. Well, doggone it. If we're going to have prostate surgery, why don't we get rehab for our penis? I said, well, that's a good point. And what I tell the guys, tell your doctor. If you're seeing a doctor, urologist, oncologist, whatever, just that, hey, I've been doing this pelvic PT, I'm getting better, I'm not having to buy the Depends, or maybe you're only using them at night or whatever. And that can really make a difference, because it's not like the doctors don't want to help. They just don't know about it. And hearing it from their patients really makes a difference. And I'm like, wow, if this works, let me know, because I've got other people to refer. So it can make a big difference, and just, not feeling like they're just, you're not designed to leak normally as you age.
No, but that's, I always talk about the difference between common and normal. And it's very common. A lot of these things, again, erectile dysfunction, having to go to the bathroom 10 times a night, it's common. And again, it's in sitcoms, it's joked about more than anything, and it's normalized, but it's not normal. It's not normal. It's something that we need to say, there's something going on there, just like, mental cognitive decline happens, but we can fight that. For some folks, it's doing crossword puzzles as you get older, just to keep your mental muscles, alive and active, instead of just playing golf every day or what have you, which, I don't want to pick on golf by any means. But the other thing that I was thinking about as you were talking is again, in terms of awareness around this, there's so many different things going on. Again, this is one that should be easily taken care of if we can just have a few, like whatever it is, 3 sessions, you know. And again, if you're paying, I don't even know what your rate is, but let's say even if someone invested $1,000 in you, I would gladly pay $1,000 to not have sexual dysfunction at some point in my life. You know, with the things that we spend money on compared to, you know, that power is. It's just, again, overcoming that. And so for me, again, I was thinking of, and there's a friend of mine who he's a personal trainer in Brooklyn, and he's still growing his mustache. I think he might have started in Movember, which is in November. And that's the reason they do that is for men's health awareness to some extent. I think it gets a little lost there. But again, you know, to have 1 month dedicated to that versus continuing this conversation, just like, you know, we continue so many of these other important conversations going on right now of mental health and how it all factors together. And so again, when you start having to go to the bathroom 3 times a night, again, that's not normal. It's affecting how well you recover, and you're speeding up the aging process. So you're speeding up the gray hairs, you're speeding up going bald, you're speeding up erectile dysfunction. So if we can improve our sleep, and that might even include that one little trick I've pulled recently is actually using a new product called LMNT, which is salt, potassium, magnesium. And I have that right before I go to bed. And it's actually lowering my cortisol levels theoretically, as well as basically not really dehydrating me, but it's lowering my need to pee. So before, again, as a 37-year-old, I would pee once a night, especially because, again, I stay pretty hydrated. The more hydrated you are, the more you're going to have to pee, outside of possible issues with prostates and things like that. But on top of all that, I'm doing that to, again, help balance out a lot of the kind of chemicals and understanding this. And this is stuff I've experimented with. I talk with folks about in terms of how that fits into your grand fitness picture, your grand longevity and health and wellness picture. So yeah, that's a fun one that, again, I'd be curious if it, you know, adds that little 1% for folks who might have an enlarged prostate, that kind of thing, and can play around with something like that product LMNT from Rob Wolf of paleo fame, which he doesn't like. He's moved a little away from that word and everything. It became all sorts of other things. Anyway, again, I do want to be respectful of your time. So again, let's tell everyone again where we can find you. I have your website up again, covering your mouth. So Laura,
there we go.
Laura McKaigPT.com. Laura McKaig PT on Instagram, right?
Yep.
Where else?
Laura McKaig PT, Instagram, Facebook. I also have kind of a resource page, both for men and women, with some free resources on Podia, Podia platform. And that can be helpful. It basically can give you tools. I always say, you know, have as many tools in your self-care toolbox as you can, because unlike medication, they're there all the time. They're always at your disposal, and it puts you in the driver's seat to help solve your own problem rather than relying on someone or someone else to do it for you all the time.
Absolutely. Self-management is really our goal as if you're a good clinician. It shouldn't be come back to see me 3 times a week for the rest of your life, not calling out any names or professions that come to mind right away. But yeah, it becomes, here's a really easy thing. You have shoulder pain. Here's a lacrosse ball. Here's what you do with it. Shove it in here, shove it in in the wall, and release that tight muscle. And that's going to solve 90% of your problems. You don't need to come see me for that. Or if we need to talk through it, we'll talk through it. But you know, we're going to be here to help you, but we want to help more people. So, you know, it's great to have a full schedule, but again, I'd rather, have you to check in on and be like, hey, how's that, you know, thing going on with your foot? And oh, it's going great. I've been able to manage it really well. And I had a little issue come up and I was able to deal with it myself. So yeah, that's part of the exciting journey process. What healthcare hopefully becomes in the near future. So we'll leave it there, guys. Thank you, Dr. Laura. We're going to go on here.
Thank you, for having me on. I appreciated that.
Sexual healing song here. This is, again, my wife's theme song, if you will, but for her, Sexual Healing Doc, shout her out. But yes, so
Yep.
We're gonna wrap it up, and again,
Alrighty.
guys, go to her website. Go set up a free 15-minute consult. Once she's booked up, she'll start charging. Whatever. Take advantage while it's free. We'll talk to you guys soon.
Alright.
And if again you're a man or you have a man in your life, get them 50% better today with a call.
There you go.